We do offer smile makeovers here, and that can include anything from simple orthodontics, because a lot of times over time your teeth start to crowd, and that crowding just continually progresses. So getting everything back in alignment and straightened nicely can completely transform someone's smile. Also, anything from veneers. So we'd take a lot of photos and take a lot of background information from patients before we even send anything to the lab to make sure that we're meeting expectations and really exceeding the expectations that the patient had coming in. I think anyone should consider a smile makeover that wants it for themselves. Fixing your smile is never going to make somebody love you or make somebody else happy. It should be about what you want. And if it's something that bothers you and you see in the mirror every day and think about it, then do it, because you're going to wake up in 30 years and maybe do it then and be like, why did I not do this earlier? Because I could have been enjoying a smile that I feel confident with this entire time. I think really discussing with the patient what they like, so we can talk about tooth shapes, tooth colors, take pictures of what they currently have, and we can even do a try on. So get back from the lab a mock-up and show them what the teeth would look like, what we expect them to look like, and make changes based off of that. It can address anything from not being confident with the way that you're smiling to your bite. So a lot of times if you've got a lot of wear with your teeth, if you're clenching and grinding, even if you don't know that you're losing height in your mouth, and we can re-establish your bite at a place that's comfortable for your jaw joint, for the muscles in your face, and for your teeth. It can vary, but from start to finish, first we want to get you in and take the record. So we want a lot of photographs, scans, x-rays. We don't want to do anything cosmetic. If there's a bigger problem going on, we don't want to put anything on a shaky foundation. So we have to make sure that the foundation is good before we get started with the cosmetic and pretty stuff. Once everything is in a healthy condition, maybe 2 months, because we have to prep everything, temporize, then order that from the lab. Sometimes we want to send something back to the lab and have a modification done, so we have to work in time for that. The smile makeover has the entire system more in mind versus just the looks, because we want to make sure that the function is matching the aesthetics and we're not compromising something or predisposing ourselves to failure in the future because we didn't deal with the entire oral health. I think it can be transformative because, again, if you're not confident with your smile, you're not smiling as much. If you're not smiling as much, you're not coming across as a happy person, and people perceive that. And it could be for the reason that you don't like your smile and you want to fix that. I think especially in this practice, our technology is invaluable. We have digital scanners where we don't have to take the goopy impressions that nobody likes. With the lasers, we can sterilize the teeth to make sure there's no bacteria left around the prep margins. We can also take away a little bit of gum tissue or a little bit of bone to maximize the aesthetics of the case. Or if a tooth has a lot of decay and we need to extend the crown margins a little bit, we can use the laser for that.